My specialty is endocrinology and diabetes. Let us take diabetes patient as such. As you know, diabetes is a chronic disease, and as such, patients need to do regularly blood sugars, and to monitor blood sugar and to change the dose sometimes, whether it is low or high. They need constant touch with the doctor as such. Doctors are not available 24 hours on phone call, so that's why teleconsultation is very, very useful for the doctor, where he is available for specified time. So also e-consultation. It's not possible for me to take this teleconsultation as well. That is why most often I'll be using the e-communication or e-consultations, where patient asks a questions and I'll be able to address it. More so when a new patient comes and when we start insulin, he wants at the beginning monitoring as well as the feedback. In such situations, it's very useful that we have a teleconsultation or a e-consultation where he will send the data regularly. We have a format, something like a electronic Excel sheet, where he will enter all the data, all the medication he is taking, including the EMR number. Then I will have access to it, I can advise. And also in case of emergency, sometimes he can also say what is to be done to the dose, to review the results and then feedback. So also children with diabetes, because small children with diabetes, parents are not aware of it, how much insulin to give and all that. So that is where it is most useful. So we have a system where patients' diet is continuously, what is the diet that is following 24, 48 hours we call, or even daily on a weekly basis, what is the exercise he is doing, or whether his compliance to medication is there or not. These are the things which we check so that patient feels comfortable, that he says, yes, I feel the doctor is always there with me. When the patient sends a e-consultation, immediately I get on my phone that a message comes that so-and-so has asked for a consultation, please log on. So with these smartphones today, anywhere in the world you can log on and then I see it. So also when I see the whole data and then answer, patient also gets a message that your message has been seen by doctor and a reply has been given. Many times if a question is not answered, if an email is not opened and a e-consultation is not completed in 6 to 8 hours, I get one more reminder. Thus, by all these things we have been able to close the loop and then see that the turnover time is very fast. So many questions about diet, exercise, medication, suddenly gets a doubt whether this medicine has to be taken before food or after food, whether they are elderly, children, pregnant women, or a sportsman or a busy businessman and all that. There are a lot of these queries in a chronic disease. So without meeting the doctor and without spending much time, he can get an answer for it. These are all the advantages where we see in day-to-day practice. That is why most of my patients are very happy with this e-consultation. The greatest thing is I feel comfortable that my patient need not worry that he is just one click of a button from the computer phone. So that contact with the patient, that continuous information is coming to me. Sometimes when I look at a patient record from, let us say, last 6 months or 8 months, I can look at all the data. I can look at all the medication that he is taking. Since I have got electronic medical record, patient puts in the hospital number or the prescription number. Even if it is not complete, I can go back to my EMR and then see what was the last visit, what is the prescription I had given and all. That is easier. Greatest advantage for a doctor is time that it saves. Because if a patient comes for personal consultation, he takes 15-20 minutes. Whereas he has a problem, it's a quick question, or whatever his data he has given, it takes hardly 20-30 seconds for me to look at the data and answer. So that way I save time, I'll be able to see more number of patients. So many times I don't want even teleconsultation, I want e-consultation. So e-consultations are best because most of them being not emergency, anytime I am free, whether it's morning, afternoon, evening, night, I can answer that question. So that the greatest advantage is saving time, seeing more patients and giving better care to the patient, trying to achieve the target rather than patient talking to me, patient coming here and waiting for long. Nearly 150 patients I have got in my this in the last 6 months. I can say 99.9% are extremely happy. So patients are very happy because they feel that their contact with me is very easy, and anywhere in the world, because a lot of my patients travel all over, so also I am also a very frequent flyer. So in these situations, when they are not able to get an appointment, they send the data to me and then say, this is what my blood sugar is, this is my problem, so that I answer them. Most of them are happy, and it's not that they get into the system and don't use it. Most of them who take these things, e-consultation, have been using it very frequently, and they have been continuing many times also, that they take for 1 month, they continue 6 months. Many of them take one card for 5 consultations, they take 20, 30, 40. That means they are quite happy sending the results, and then they ask, when should I see you next time? The initial challenge was convincing the patient and also accepting the technology file. So to convince the patient, it is not sufficient if the paramedical staff in a hospital tell them such a system is available, enroll. I think the basic thing was that I have to convince the patient. I tell the patient that, look here, you cannot call me on my mobile, you cannot contact me over the landline and all that. This needs constant feedback. So first thing I said, this is a system what we have got, e-consultation, teleconsultation. If you accept this sort of what we have got technology, it will be good for you, good for me. Sometimes a patient calls and say, I have not seen you, can I have an e-consultation? I said, sorry, no. First time you have to come to the doctor, I have to take this, I have to examine. This is a science that is still practiced initially by interview. Only when I know all your background examined, then the subsequent consultation can be there. First consultation cannot be consultation. We have already done about 2 months of pilot, and once we finished the 2 months pilot, it was so successful. Patient acceptance and doctor acceptance, paramedical acceptance was so good, we were able to continue beyond 6 months. That is again because once we see the patient and tell them this is what it is, patient says, I am very happy with it. Other thing what we find, sometimes patient says, he is not tech savvy, he says, I have been training, I am not going to get. So don't worry. We always give one of the person's name or contact number in our center, so that patient feels that he is not able to send email, he will contact that person directly from mobile, and that person is available always, and he or she says, don't worry, now you log on to the computer, I will tell you, go to this website, now you put your question, this is how you click, because they may not be very much used to that system. So somebody is there hand holding and then tell them this what it is. This is the system what we did, so that it helps, and the patient says, thank you very much, I could not contact the doctor and I could not get an email, and you have told me, you have literally guided me how to do it. Other problem what we find is sometimes patients send a consultation, I don't know. To sort out that, we have the system where we started getting SMS. Once I get an SMS, yes, I am happy, there are 2 questions waiting, then I log on. Otherwise I can't 24 hours be online. So also many times patients send, they don't know whether they have got an answer or not. So by introducing that system, patient also gets an SMS that your query has been answered, please log on to this, and then get the question. Other challenges we found is patient takes a card continuously 2 months, 3 months, 4 months, he continues to send message without getting a clinical examination done. To fight this challenge, we said, sorry, at the end of 3 months of consultation, you have to come to the hospital, get a HbA1c, get your blood pressure checked, and you have to be examined by doctor. You cannot indefinitely go on doing it. It's otherwise a patient thinks, he gets into the system, next 10 years I don't have to see doctor. We send a reminder, sorry, last time you had seen was 3 months back, now you are due, you come and visit, take an appointment from the clinic, then you can continue another 3 months. So that's why I make it very clear at the beginning that we have to come there once in 3 months. So if you look in India, India is a developing country and the affluence is improving. Again, if you look at phones, that majority of the people, maybe 6 or 10, 20 million people, have got the mobile phone. So that is one of the greatest advantages. So also the number of people who are using internet, tech savvy is also increasing. Even if there are senior citizens who are not able to do it, their children and grandchildren are tech savvy. So that's why they say, grandfather and all, you tell me the result, I will log on and send it. So there is a great potential for e-consultations and teleconsultations. Right now what we have teleconsultation is mostly at tertiary level. I feel in the next decade or so it should move on to secondary care provider and even primary care physician. That means your family doctor, your specialist and super specialist, at all levels it should be there. And also as it grows, whatever it is happening now between the doctor and patient, tomorrow the patient may say, I want to have this, a copy of it goes to my son in USA or Australia or anything. Or he says, whenever this information goes, I want to keep my primary care physician in the loop. So patient asks a question, it goes through the primary care to the tertiary care, he answers, again the primary care doctor will know what is happening between them. In case he finds that a personal examination is necessary, the patient may not get tertiary care, the primary care physician may take care. So like that, once we have the technology that improves, then we can give better one. Maybe over a period of time, it will be a virtual consultation. I feel in future, maybe in another 5 years, more than 50% of my consultation should become e-consultation. What is now only 10% or 15% of consultation should become more than 50%. And also probably a time will come where there will be a virtual consultation where patient is talking to the doctor, doctor is talking to the patient in that specified time. Or there is a video clipping where it says, because patient wants to hear the doctor's name. If that comes, it is virtual consultation. A test has to be done. So through e-consultation, patient is having an equipment and he holds it there and I am able to see the blood sugar. I can do HbA1c. Patient need not travel, so that lot of time, money, energy is saved by the patient. So I feel there is a great scope for e-consultation, teleconsultation. Once all these technologies are inbuilt and then you go on improvising on it, that will be the standard of care in future.